This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
The right to confidentiality of a person's responses on psychometric and educational tests is governed by national, professional, and organizational policy to ensure that tests are used to promote high standards and inform best practices. Confidentiality in the professional clinician context. It is important for professional clinicians to adhere to a set of guidelines to make decisions about the therapeutic relationship that promotes health, well-being, and the rights of all stakeholders to cultivate bonds of trust throughout the community. Thus, all testing materials are not permitted to circulate freely, they are kept in a secure place. Ideally, the individual tests are depersonalized by having client participant numbers. Tests should be locked separately to signed informed consent forms and any other materials that could link clients' participants to raw data or even to have had a test. Materials remain in a secure place, preferably locked, for at least 5 years. The tests themselves are not to be left in the care of a third party if that party is not qualified to administer them. In a case such as this, there is more potential for a breach of confidentiality, as the unqualified administrator of the test may ask the client participant to record personal details on the test, or they may forget to ask the client participant not to do so. It is also highly likely that the unqualified will not be familiar with the ethical practices of the professional clinician, and so will not be aware or understand the concept of the right to confidentiality. This situation places the client participant at risk of harm as circulation of their details, raw data or demographics, may lead to adverse consequences to themselves, such as disappointment that their trust has been violated, creating a lack of engagement with learning or accessing therapeutic care when needed. Confidentiality in the educational organizational context. Students and employees have the right for their test results and participation in tests to not be communicated to a third party without their knowledge and explicit permission, such as in the form of a signed informed consent form. Such forms spell out clearly what is expected of the client participant and how their information will be used, thus, who has access to it. Additionally, students' employees are able to access their tests, as this is their personal data. However, this may necessitate the application for freedom of information when data is stored in a government facility. Furthermore, some tests may be considered exempt from disclosure, given that to do so would not be in the best interest of the public. For example, when disclosure would invalidate the use of the test in the practice of the profession it is being used. Otherwise, disclosure would not occur if it could impair the ability of the educational institute or other organization to perform their duties properly. Finally, when disclosure would be considered as a breach of the contractual arrangements by which the institution organization has agreed with the suppliers of the test materials. In conclusion, professional clinicians, educational institutes, and other organizations that make use of psychometric and/or educational tests adhere to a set of standards in which the right to confidentiality is a key concept. Best practices for administering tests, analyzing them, and storing and using the data are critical to ensure that the standard of confidentiality of test takers is maintained, especially in light of technological advances when standards must be modified to keep pace with change. This essay on the role of confidentiality in psychometric and educational testing was written and submitted by a student just like you. The Ivy Panda Samples database hosts thousands of works similar to this one, on various subjects. Visit ivypanda.com to find what you are looking for, free of charge.